Hey guys, I'm Tasha.
Hey listeners, this is Guni.
And you're tuned in to Dietary, the podcast, where we chat and explore all things on integrative medicine. Hey everyone, so for those of you tuning in, today we have an awesome guest, an Ayurvedic practitioner and health coach, Miss Varalakshmi. She's based in Birmingham in the UK, and her daily work is around helping women who suffer from gut health issues, hormonal imbalances, and reproductive health issues. And so, in today's discussion, we're going to talk to her about female reproductive health and try our best to unpack this experience for women. So, welcome to Dietary, the podcast, Miss Varalakshmi. Thank you so much for being here with us.
Thank you. Thank you so much for having me. I'm so looking forward to our conversation. Super excited to share.
So you've been practicing for 10 years. Tell us a bit more about the process about getting qualified as an Ayurvedic practitioner.
I studied my degree in Bachelor's of Ayurvedic Medicine and Surgery. So just like a modern conventional medicine where they take 5.5 years, and for completing our degree, we have to study all the modern anatomy, physiology, everything, along with studying Ayurvedic anatomy, physiology, and the concept books of Ayurveda, like the Charaka Samhita, Sushruta Samhita, and all.
Yeah, you don't hear that it takes 5 years to complete your degree and actually treat people in Ayurveda, right?
Yeah, the funny thing is that we study the anatomy, physiology, and part, not only books, but we get trained. Like 1 year of our house surgeoncy contains 3 months of working in a government hospital. We worked there in different departments, 1 week, 10 days, each department in the modern medicine hospital, doing that internship. So it's not just about studying Ayurveda and doing Ayurveda. So the rest of the 9 months, we do the same internship in a government Ayurvedic hospital, and also during the toxicology and then forensic science, we study at third year. We had to go to 1 month to attend how they do autopsy, and then learning about the poisonous herbs. So we go and then study under a modern doctor to do all that. So yeah, it's very, very detailed, and it does cover all the parts that conventional doctor trains through from a Ayurvedic perspective more, but still there are bits where we do our part in learning about modern science as well.
And I think one of the misconception of alternative and complementary healthcare practices is that it's kind of taken for granted that there are some countries that take this very seriously, especially in India. India having its own department, I think the Ayush department. I think that there's this common misconception in the West, which is what is the actual background and what practitioners have to be able to practice in. And I think that is a current issue because it varies from one coach to a practitioner to a doctor. That also is very different. It's quite interesting to have your background to be able to frame it for our listeners as well as we move along.
For sure. Which really brings us to our next point. So in our research for hormonal imbalances, we came across many myths around PCOS. And I guess one of the most common myths we found was that PCOS is something that you are inherently born with. So do you mind just unpacking that a little bit more for us?
Yep. And as you unpack this myth, could you go over what PCOS means, just for the listeners who don't really know about it?
It's absolutely. So PCOS is Polycystic Ovarian Syndrome, because syndrome means that it is a group of symptoms, and it's not just one condition. PCOS can trigger a multiple level organ associated symptoms. Like the most common symptoms that we can see in a broad general population is having irregular periods, not having periods on once a month or so, but they can have anything ranging from 3 months to 6 months. So some women can get like 2 months once a period to 3 months once a period, to even having a gap of 6 months, even 1 year of gap. Okay, so that's the main symptom, irregular periods.
Does longer periods, like extensive period, falls into that too?
You mean like excessive bleeding?
Yeah, long,
Like
exactly.
Yeah. So in my experience, and as far as I understand the PCOS, very rarely it is the case that a woman with PCOS can suffer with excessive bleeding, but it's often the other side of the spectrum where you have less periods, means like long gap in
Awesome.
between two periods.
Okay.
Got it.
Yeah, so C is a second symptom is to do with the metabolism, because PCOS is still a, even though it is very common condition that affects women across the globe, we are still trying to understand why it is happening and how it affects the women at different stages. So far, what they understood is that it does affect our metabolism. So there is what we called insulin resistance in these women, which means that whenever we are eating food, our body releases the insulin, and insulin helps us to convert that food to into glucose so that we can utilize all the cells in the body utilize it. But the resistance means that for the women who has this condition, they can have a symptom where your body will not react to this insulin anymore. That means that whatever the food that you're eating is not going through the proper channels, so it's not converting into nourishment or energy, but it can go through other pathways like becoming a fat, especially in the lower abdomen, and so makes it difficult for them to lose weight. No nourishment, no proper metabolism, then end of the day they don't have any energy. That is another common symptom that we can see. So they can have weight gain as a symptom. And there is also other things like to do with the male hormones, excessive androgens. We all have testosterone in minute doses in our body, but in women with PCOS have a pattern where they have this in excess amounts. That means that male hormone in men, why they have beard and all these like pimples and rough skin and all, we see that, right? It's a secondary sexual character. It's a normal character for men. But for us women, it is not considered as normal. And because of having too much testosterone, the women can develop this acne, especially on the chin, on the back of the neck, on the face, and unwanted hair. That is also, another character that we commonly see in PCOS.
When you say unwanted hair, what do you mean? Because let's face it, we
Yeah.
are hairy. We have, underarms hair. We have, so what is too much hair?
Okay, so when I'm saying unwanted hair, the mustache and the beard areas, and it is so
Okay.
prominent, like a male characteristic, if that makes sense. I'm not
Just
dividing
a
it.
bit more.
Yes, it is
All
more,
right.
and it can cause this social stigma to the women who suffer with PCOS. For a normal girl or women without PCOS, for example, if you do threading or
Yeah.
you do waxing,
Exactly.
yeah,
I was gonna say
yeah. So for
exactly.
them,
Yeah.
what happens is that even with that, the hair growth is too much that within a week or so, it will grow back quickly and it will make them look, what
A
do you
bit more
call that?
masculine or
Yes, masculine. Yes, exactly. Thanks.
all right.
So yes,
All
these are
right.
the common symptoms. And coming
Okay.
to the question of the myth that she was talking about, whether it's to do with the genetic or not. So there are several theories and studies. Still, again, this is in a very baby stage of understanding whether PCOS is a genetic condition or not. But so far, the studies show that if a mother has the traits of PCOS, then the daughter can actually also have a chance of having PCOS traits. Okay, again, this is not 100% proved to say that you will be born with PCOS. Even if some women who have these genetic traits can turn out absolutely fine. So yeah, that is my take on it when it comes to whether it's a myth or fact.
There's this myth that only people who are obese has PCOS.
PCOS.
Yeah, so it is exactly a myth. Again, coming back to some of these symptoms, like any other disease out there, even though every disease have like, let's say, 10 symptoms which are named under that disease, it's not a straight shot that everybody with that disease will have all the 10 symptoms. Not everybody will have insulin resistance and suffer with weight gain. Some women can have more testosterone and end up with infertility kind of issues. And some women, even with PCOS, they turn out to be completely fine with no weight problems or with no metabolism problems and still able to have like 2, 3 kids. So we have to take each and every case as unique here. There are some theories saying that it can be divided into like different types basing on like pill induced PCOS, wherein women who went on this contraceptive pill for a long time can get it, and then insulin resistance type, and then androgen based. But I don't want to go into that deeper. All I'm trying to say is it's important for us to acknowledge that even though diseases have common symptoms and we do talk about all these different scenarios, not everybody will be same. There is a chance that we see more cases of women with PCOS being overweight. This comes down to not understanding the disease at an earlier stage and not able to change their diet and lifestyle.
Yeah, that was really insightful. And actually, you kind of mentioned a bit about our third myth, which we found as a really common issue among women and even our own friend circles, is that you can't get pregnant if you have PCOS. So is that a myth?
Okay, so personally as well, I work with several women who can get pregnant even with PCOS. Some women don't even realize that they have PCOS and completely, lead a normal life. So I would say we can call it as a myth because there is a chance of you getting pregnant as long as you change your diet and lifestyle again. We keep coming back to the same pattern. But yes, I would call it a myth.
How can Ayurveda help with that healing part in your experience?
Okay, I would advise women, whoever are diagnosed with PCOS, to look at their digestion, because this is where it helps a lot if you understand your body as not like a single thing, like everything in your body is interconnected. Like, look at what are the patterns. First thing is to look at digestion. Are you having a good bowel movement? Then, if you are not having a good bowel movement, then comes the idea of what foods are you struggling to digest. In my experience, women with PCOS often have gut intolerances or sensitivities, we call them, like to do with, like certain foods like wheat, dairy in some women, and maintain a good food diary, which is very, very powerful tool for anybody with gut health imbalances. All you have to do is 1 week you sit there and write down what you're eating and then how you're feeling afterwards, like a remark kind of thing. You just note down if you have something like chapati for lunch, then have you felt like foggy, like low energetic after having, or heaviness, or feeling like bloating, pain in your tummy, then it's a clear indication that you are struggling to digest that particular grain. Yeah.
So
So,
analyzing how you process it, what you're processing. Okay.
And the
yeah,
emotion, like the sensation that you feel after.
exactly. And then look at your stress patterns in your body and how you are dealing with them. Okay, we all have stress and it is part of our life, but how you're dealing with it is an important factor.
Yeah.
So you need to release whatever that stress you're holding for a long time, chronic day-to-day induced stress. So practice more breathing. Breathing is one such amazing tool that helps all the women. I would say all the people on this universe to help us to
Mhm.
connect with our body. Breathing is a great, powerful tool. I would say even a simple sitting, closing your eyes, and just focusing on your breathing, and just letting go. And things like self journaling and Ayurvedic daily rituals like Abhyanga.
Would you care to explain to our audience what is Abhyanga?
Absolutely. Abhyanga is application of warm oil on our body. It's a very gentle process. You don't need to put any pressure on your body, but I recommend cold pressed unrefined sesame oil or a simple organic sesame oil and apply all over your body. It's like the, I think, best self-love ritual you can say, because
Mm.
you will feel very nourished and it has great health benefits to it.
And if we were to shift to fertility, because most of, especially women in the West, are taking some form of contraceptive pill or contraceptive method. And so this transition from stopping this completely and getting your body ready to be able to conceive, what are some of the things you think women can do, and how can not only is getting your body ready for that, but the whole anxiety part of it. Oh, now I need to conceive and I need to be ready. It needs to happen. So, what is your experience in getting women in through that transition?
Ayurveda beautifully explains that unplanned pregnancies can happen. My first son is a unplanned pregnancy. It's a it's just an accident, you can say.
No, it's a
But
blessing.
yes, yeah, like blessing in disguise. So what Ayurveda encourages couples to do is to plan for the pregnancy and prepare for pregnancy. At least have 6 months to 1 year of preparation before you actually going to like stop this contraceptive pill and all. So my few suggestions from my experience and all is that try to stop the pill once you decided to focus on conceiving. Then maybe 6 months should be an ideal gap. If you have no other health problems and all, if you can stop 1 year, that is also good. Then mentally to prepare you and your husband, and looking at the support structure in your family. And then comes the part of your sukra. Artava is the ovum in Ayurveda, sukra is the sperm. So the health of both of them has to be very good. So they need to start eating ojas increasing foods like, dates, iron, and then
So
soaked
you
and
might
peeled nuts.
Could you just explain what ojas is? Because some people might be new to Ayurveda, completely
Yeah,
new.
sorry.
No, no worries.
So ojas is like in Ayurveda, when we are talking about nourishment, digestion, right? When we are eating food, then it gets digested if you have a good digestive fire, and it goes through 7 stages. Like the food is turned into 7 different tissues or dhatus, we call them. After these 7 tissue systems or organ systems are nourished, it's like a drainage system. You can imagine, like first tissue will be nourished, and whatever the nourishment left goes to second, and so on and so on. And so after the 7 tissues are formed, there is this ultimate refined nourishment which has the part of all the tissues it has nourished. Okay, this essence.
would it be equivalent of saying in the Western side, kind of the ultimate refined nutrients that are ready after your digestion and how they go to your body and
Yes, ojas can be understood as this life source.
oh.
Every time you eat, you are storing this energy source in your body. In each and every cell, you have to imagine you have this strength.
So if we were to kind of wrap up our conversation today, we spoke about PCOS and kind of some of the misconception, the myths, and then spoke about the transition between stopping the pill and getting ready to conceive. We want to kind of revert back to you now. What's next for you now? What are you looking forward in your practice?
There is not much planned, but one thing I would say is for women, self care is often underrated, no matter what you do. So, our body reproductive system considers stress as the biggest enemy, and self care is the only thing that we can use in this day and age to balance it out. And try to remember that you're an important person. So if you are a better, healthier version of yourself, you have more energy to take care of everybody else.
So spreading the word about self-care to women out there.
Nice.
Right.
Awesome. So, for our listeners, how can they find you and where can they reach out to you if they're interested to know more about Ayurveda? And
My Instagram handle is at the rate Dr. Varalakshmi. So they can follow me, they can just DM me any questions. I do Instagram lives as well once a week on different topic, usually related to gut health, Ayurveda and women's health. And also loads and loads of information on my Instagram page. Always here to help, even if you don't want my consultation personally. That's not the idea here. Idea is to empower and educate women of all ages. That's the main goal and passion. So yeah.
Yes. Wow.
love it,
That's
love
good.
it.
Thank you so much.
Yeah, it's been really insightful to speak to you and learn from you.
Thank you so much, guys, for having me.
If you enjoyed this episode, go ahead and select that follow or subscribe button. For now, stay safe and we'll see you next week.